All right, before we conclude this section, we do want to talk just briefly about some various urinary system disorders. There are a lot of different illnesses, especially things like diabetes and hypertension, that can cause progressive renal disease and renal failure. And so there are a couple of things like, or a lot of different terminology that you might hear. Urethritis is an infection of the urethra. Cystitis is an infection of the urinary bladder, while pyelonephritis is going to be infection of the kidneys. Now, there are a lot of different infections that can occur in various locations. Urinary tract infections, enlarged prostate gland, pH imbalances, or an intake of too much calcium can ultimately lead to the formation of kidney stones. Kidney stones are going to be those hard granules made out of calcium, phosphate, uric acid, proteins. Those are going to be formed in the renal pelvis, and a lot of times they can actually pass unnoticed in the urine flow. So you're never even aware that they exist. However, if they are large, they can become incredibly painful. They can start to block that renal pelvis or the ureter and ultimately lead to the destruction of the urinary system, lead to the destruction of the kidneys if they cause too much blockage and backup. So that reverse pressure can kind of build up and destroy those nephrons individually. So one of the very first signs of nephron damage is going to be albumin. That white blood cells or even red blood cells might be found in the urine. So we're not going to be filtering things properly. And we can start to see things that should not be in the urine appearing in the urine. This can usually be detected through urinalysis, which is just, it's exactly what it sounds like. It's an analysis of the urine. Uremia is an accumulation of urea and other wastes in the blood. This typically occurs when kidney damage is so extensive that more than 2/3 of the nephrons are inoperative, and so there's not enough nephrons to kind of pick up the slack of the damaged portions of the kidneys. There are nitrogenous wastes that can cause serious damage. The retention of water and salts after kidney damage is actually even greater concern than the buildup of wastes. The building up or the retention of water can cause edema, fluid accumulation in the body tissues. Abnormal ion imbalance can lead to the loss of consciousness, could even lead to heart failure. So this is why it's so important to keep those kidneys healthy. In the event that we are seeing or experiencing kidney failure, we can start to see a kidney transplant. It can be one way to treat kidney failure or renal failure. Patients with renal failure sometimes undergo a kidney transplant operation. Just like with all organ transplant, there is always the concern that the host will reject the organ that they are receiving. So the current survival rate, 1-year survival rate, is 97% if the kidney is received from a relative, 90% if it's received from a non-relative but does have a matching blood type. So it's very important. While there has been a lot of success with replacing kidneys, there's been a lot of success with kidney transplant, it is still very important to protect your kidneys and keep them in good working order. So you should be able to list in detail a few of the common causes of renal disease, provide examples of diseases associated with the urinary tract and kidneys. And I think you should also be able to spend a little bit of time, think about it. Why would hemodialysis would need to be done frequently in a patient with renal failure? So look into that a little bit in your textbook and explain what the process is and why that's necessary for a patient with renal failure. Why is it not a one-time treatment? Why does it need to be done frequently? All right, and that's all we have for this section. Please let me know if you have any questions, comments, or concerns.